Hi everyone, I'm Dr. Alex. I'm an ENT doctor with Asian Healthcare Specialist. Today I'll be talking about snoring and sleep apnea. Alright, so snoring is closely related to sleep apnea, but they are in fact two different conditions. Let me explain. In snoring, when air flows through a narrow airway, this results in vibration of soft tissues in our throat, and this will result in the sound of snoring. As opposed to sleep apnea, for sleep apnea there are two types of sleep apnea, obstructive and central. Between the two, obstructive sleep apnea is more common. In this condition, it is more serious condition compared to snoring, because in obstructive sleep apnea, when one sleeps, there is repeated obstruction to the airway. Sometimes it might even, in a patient with OSA, they might even stop breathing during their sleep, and this can happen multiple times throughout the night. And when this happens, our body wakes up to breathe better. But you can imagine if this happens multiple times throughout the night, the sleep quality will be affected. And despite having slept enough, adequate number of hours, the sleep is not refreshing. And in such a condition, it is important to get it treated because it has been known to be related to an increased risk of a stroke and heart attack. Okay, so some of the factors and causations of snoring and sleep apnea include relaxation of muscles in our throat that usually keeps our airway open. These muscles will relax when one sleeps, so this results in narrowing of our airways. And this relaxation of muscles can be worsened if one takes alcohol. Secondly, if anyone has nasal obstruction from various conditions such as nasal allergy or sinusitis, this will contribute to a narrowing of our upper airway, resulting in worse snoring and OSA as well. Thirdly, our sleeping positions can narrow our airway more. For example, if one is sleeping on our back, there is an increased collapse of our soft palate as well as our tongue, and this will decrease the upper airway airflow. And lastly, with weight gain and obesity, this results in narrowing of our upper airway as well. Right, so if one's snoring is associated with some of these red flag symptoms of obstructive sleep apnea, for example, choking or gasping episode when one is sleeping, or despite sleeping adequate number of hours, one has excessive daytime sleepiness, it is recommended that you consult your ENT specialist to assess for obstructive sleep apnea. Alright, so first up in our clinic consult, I will be going through the symptoms of the patient, how severe it is, and how it has affected the daily activities of the patient. Secondly, we'll proceed on with physical examination, whereby we'll be doing a nasal endoscopy to assess the patency of the nasal airway as well as the throat, and see where the potential sites of airway obstruction is. And lastly, we will be arranging for a sleep study to be done. In such a test, we will be assessing the breathing as well as the oxygen level in our patients while they are sleeping. And with all the data gathered together in the sleep study, we will be able to tell whether the patient has obstructive sleep apnea or not. And if it's present, we can even tell whether the severity of it, whether it's mild, moderate, or severe. Alright, there are various options available to treat obstructive sleep apnea. The gold standard of treatment is CPAP therapy. CPAP stands for Continuous Positive Airway Pressure, and essentially in this treatment, a patient will be wearing a device that helps them breathe better when they are sleeping, as this will keep their upper airway open while they sleep. Other options of treatment include lifestyle changes. For example, one can sleep on their side instead of sleeping flat, because this will result in less upper airway collapse. Avoiding alcohol before sleeping will help as well. And lastly, to lose some weight, because obesity is known to narrow our upper airway as well. There's also the option of surgery should there be any correctable structural narrowing in our upper airway. And lastly, there's also the option of oral appliances, which we can wear to keep our upper airway open.